Diabetes and insulin resistance are closely related conditions that affect how your body manages blood sugar. In diabetes, particularly type 2, the body either doesn't produce enough insulin or can't use insulin effectively, leading to elevated blood glucose levels. Insulin resistance typically precedes this, where the body's cells don't respond well to insulin, causing the pancreas to produce more in an attempt to manage blood sugar. Symptoms of diabetes can include excessive thirst, frequent urination, tiredness, and blurred vision, while insulin resistance often has no obvious symptoms, but can manifest as fatigue or a condition called acanthosis nigricans, darkened patches of skin. Treatment for both conditions often involves lifestyle changes, such as diet and exercise, and for diabetes may also include blood sugar monitoring and medication or insulin therapy. Risk factors for developing either condition include being overweight, a sedentary lifestyle, genetics, and certain medical conditions like polycystic ovary syndrome, PCOS. Here's a closer look at the detailed aspects of diabetes and insulin resistance, their interrelation, and their impact on health. Pathophysiological mechanism, endocrine dysfunction versus cellular unresponsiveness. In the context of diabetes versus insulin resistance, understanding the pathophysiological mechanisms is crucial. Diabetes, particularly type 2, often stems from insulin resistance, where the body's cells fail to respond appropriately to insulin. Initially, the pancreas compensates by producing more insulin, but over time, this hyperinsulinemia may not suffice, leading to elevated blood glucose levels and the diagnosis of diabetes. On the other hand, insulin resistance can exist without full-blown diabetes, acting as a precursor condition signifying the decreased efficacy of insulin in glucose uptake. This distinction is fundamental in treatment as diabetes may require exogenous insulin, while insulin resistance is primarily managed with lifestyle modifications and medications that improve insulin sensitivity. Blood sugar control, insufficient insulin production versus ineffective insulin action. In the context of diabetes and insulin resistance, understanding the intricate dance of blood sugar control is key. Type 1 diabetes is characterized by the pancreas's failure to produce sufficient insulin, resulting in lifelong dependency on insulin injections. In contrast, type 2 diabetes often begins with insulin resistance, where the body's cells are unresponsive to insulin signals, despite adequate production. Here, the pancreas may initially overcompensate by producing more insulin, but over time, this can lead to insulin-producing cell burnout. Consequently, blood sugar levels rise, paving the way for a cascade of health issues that goes beyond just hyperglycemia, affecting everything from cardiovascular health to nerve function. Understanding these nuances is crucial for management and treatment. While type 1 diabetes necessitates insulin replacement, type 2 involves a combination of lifestyle interventions and medications to improve insulin sensitivity and sometimes insulin supplementation as the disease progresses. Onset pattern, chronic progressive disease versus pre-diabetic condition. In differentiating between diabetes and insulin resistance, it's critical to recognize that insulin resistance is often the prelude to type 2 diabetes. Insulin resistance occurs when cells in the body become less sensitive to the hormone insulin, which regulates blood sugar levels. As a result, the pancreas compensates by producing more insulin, maintaining normal glucose levels but straining pancreatic function over time. If unchecked, this progressive overworking can lead to the exhaustion of insulin-producing cells, culminating in chronic elevations of blood sugar or diabetes. Unlike the sudden symptoms of type 1 diabetes, both insulin resistance and type 2 diabetes develop over a prolonged period, often with subtle initial symptoms that may be missed until significant metabolic disturbances have occurred. Therefore, early detection through screening and lifestyle modifications is crucial in halting or slowing the progression from insulin resistance to full-blown diabetes. Associated risk factors: autoimmune response versus metabolic syndrome. Autoimmune responses play a pivotal role in type 1 diabetes, where the body erroneously targets and destroys insulin-producing beta cells in the pancreas, rendering the body incapable of regulating blood sugar effectively. Unlike type 2 diabetes, which is often a consequence of insulin resistance, Type 1 is not typically associated with lifestyle factors, but rather with genetic predisposition and possibly environmental triggers. Conversely, insulin resistance is a hallmark of metabolic syndrome and type 2 diabetes, stemming from a combination of genetic factors and lifestyle choices such as poor diet, obesity, and physical inactivity. It signifies the body's diminished response to insulin, requiring more of this hormone to manage glucose levels, thereby increasing the pancreas's workload and potentially exhausting its capacity over time. Addressing insulin resistance through lifestyle changes and medications can reduce the risk of progressing to full-blown type 2 diabetes. Primary treatment focus: blood glucose management versus sensitivity restoration. In addressing diabetes, blood glucose management takes the spotlight. Patients are tasked with monitoring their blood sugar levels and utilizing medications such as insulin or oral hypoglycemics to maintain glycemic control. It's a relentless balancing act to prevent the peaks and valleys that can lead to dire health events. On the flip side, when tackling insulin resistance, the cornerstone is restoring the body's response to insulin. Lifestyle interventions come to the fore: dietary changes to reduce sugar and processed foods, regular exercise, and possibly medication like metformin to enhance tissue sensitivity. The aim is to coax the body back to a state where it can efficiently use insulin, keeping diabetes at bay. Both conditions demand a nuanced approach, focused on either reining in glucose levels directly or indirectly by rehabilitating the insulin-glucose relationship.